This is The Broken Shift with Nurse Natalie. Healthcare doesn't break in chaos, it breaks quietly. When something goes wrong in healthcare, the timeline moves so fast, not medically, but socially. Before the chart is reviewed, before the autopsy is complete, before any formal investigation has finished, the question becomes, who is responsible? Everybody want to know who done it. Right? Who done it? And more often than not, the answer lands in the same place first. The nurse. The nurse done it. Now, a recent case involving Lauren Tussey, a young mother who died after a plastic surgery procedure, has gained widespread attention online. Her husband has shared his experience publicly, including on TikTok. And we all know about TikTok, right? He's describing what he believes happened during her post-operative care. And, you know, her story is very tragic. It's so tragic. So we're not faulting him for that. But here's the thing. A young woman undergoes an elective procedure. She does not survive. And now a family is left searching for answers. And who done it? At this stage, the full medical facts have not been publicly established. Of course not. There's no finalized autopsy report widely released, right? But what we do know is that this woman is now deceased. But the investigation has not yet been completed. So, the conversation has already moved forward though. And in many spaces online, blame has already been assigned. And like many cases that unfold publicly, what people are reacting to is not the full medical record, right? Nobody has her medical record out here. Nobody knows what her medical history was. What they're reacting to is the moment shared in real time during grief. They're reacting to her family's grief. And so the pattern is blame before evidence. This is not unique to this case either. It is a pattern seen across healthcare. A bad outcome occurs and the details are incomplete, right? The emotional impact is immediate because there's a death or there's an injury, and the system responds not with patience about let's wait and see what happened, but with urgency to identify who is at fault. Healthcare workers, especially nurses, often become the most visible target in these cases. Not because they are always responsible, but because they are the most present. They were the one there when things were going wrong. They're the ones at the bedside. And in moments of crises, visibility often becomes liability, especially when there's grief involved. Another layer that's often misunderstood is the risk itself. All surgical procedures carry risk, even elective procedures. Plastic surgery is not exempt from this. Procedures like abdominoplasty, commonly known as a tummy tuck, carries known complications including pulmonary embolism. Those are clots in your lungs. Fat embolism. Those are fatty clots. Hemorrhaging, that's bleeding out, infection, and anesthesia complications, and in rare cases, death. I mean, I took my dog to a vet to have an elective surgery. We took her to get spayed, and my goodness, they called us an hour later and said she didn't make it. There were complications with the anesthesia, and we never thought about it. We never thought twice about that. So think about that as I'm talking about this. And the reason I want you to think about that is because estimated mortality rates for these procedures are low, often cited around 1 in 10,000 to even 1 in 20,000. But low risk does not equal zero risk. And when complications do occur, they can develop rapidly. A patient can appear stable and then deteriorate within minutes. You are under anesthesia. What I'm going to talk about is informed consent versus real understanding, because before surgery, patients are told these risks. They sign consent forms and say, yes, we understand. But do they? They are informed that complications, including death, are possible. My husband went in and had a cardiac cath, and he said, it's kind of scary. They keep coming and telling me if I understand the risk that, up to including death, like, am I going to die? And I said, no, you're most likely not going to die, but they don't know, because they don't know what's going to happen until they anesthetize you. They don't know what's going to happen. Are you going to have an embolism? They don't know. They can't guarantee. Every patient is different. And so when they are coming and they're telling you this, and you hear a lot of people go through cardiac cath and they come out and they're fine, you just sign the paperwork thinking, I'm going to be fine. And your family's like, okay, you're going to be fine. But when something goes wrong now, it's like, well, whose fault is that? Because they were supposed to be fine. Anyway, I digress. But there is a gap in healthcare that often goes unrecognized. Being told a risk exists is not the same as believing it will happen. Patients hear rare complication and interpret, oh, this won't happen to me. How many of you have gone into surgery and came out fine, right? You didn't think it was going to happen to you, or else if you thought it was going to happen to you, you wouldn't have signed the paperwork. And then add in anxiety, medical language, time pressure, and trust in the system. And what's documented as informed consent may not reflect true understanding of the risk. So when something goes wrong, it doesn't feel like a known risk. It feels like a mistake, like it shouldn't have happened. And that shift changes everything. Everything. Because the question becomes, who did it? Who done it? Right? It's like a game we're playing Clue. Who done it? Another factor that shapes these situations is imbalance. Families can speak publicly about these situations when they happen. Healthcare workers usually cannot. Why? Due to privacy laws, employer policies, and legal risk. Nurses involved in a case often cannot explain what actually happened. They cannot clarify what interventions were performed, what the patient's condition was, and what decisions were made in real time. So when I say that we don't have the facts as we're making decisions, we just see the person's grief that's on the other side, where that one side of the story is visible. And the other side remains silent. And in that silence, assumptions fill the gap. A critical distinction often gets lost in these moments. A bad outcome does not automatically mean negligence. A complication can occur even when care is appropriate. That's the risk. And at the same time, negligence can occur. Mistakes do happen. I'm not saying that they don't. This is why investigations exist, and we need to give the investigations time to show what happened, to determine what actually happened. But that requires medical records, expert review, timelines, and sometimes autopsy reports and results. Not assumptions made in real time. And the legal layer to this is that when cases like this move into legal territory, multiple individuals are often named. Not because guilt has already been proven, no, but because that is how the legal process works. Anyone who is involved gets now brought in for questioning. That creates a system where healthcare workers feel exposed, unsupported, and easily replaceable. Even before the facts are known. And, grief is not logical, by the way. There's nothing logical when someone's grieving. When loss is sudden, people search for something to hold on to. We get it. We're healthcare professionals. They want an explanation, a cause, a person to blame, a person to point a finger at. Not because it is accurate, but because it provides structure in the chaos. It gives them something to hold on to in their pain. Healthcare workers often become the chosen target. And social media changes the speed of everything. Stories spread quickly. Stories go viral. Emotions spread faster. And complex medical situations are reduced to simplified narratives. Not the complex medical records that we see as healthcare professionals. By the time the investigations are complete, many people have already decided what happened without knowing, without the facts. In healthcare, situations like this are not theoretical. Many providers have seen patients experience devastating complications. Personally, I've worked with someone whose family member died after a cosmetic procedure due to unexpected complications. Well, at least they didn't expect it. They were told, but probably didn't expect it. And that experience reinforces a difficult reality. These outcomes, while rare, they're real. They can happen. They are not always preventable. This doesn't mean healthcare workers should never be held accountable. That's definitely not what I'm saying. They should be. When negligence occurs, it should be addressed. But accountability requires accuracy. And accuracy requires time to get all the facts. And currently what is happening more often is something different. Blame is being assigned before the facts exist. So the problem is not that families ask questions. That's not a problem. They should. They should ask questions. The problem is not that people want answers. They deserve the answers. The problem is the speed at which conclusions are drawn before those answers exist. Because once blame is assigned publicly, it is very difficult to reverse. In healthcare, not every bad outcome is preventable. That's facts. But every outcome deserves to be understood before someone is blamed for it. This is The Broken Shift. Hit that like button, subscribe, and I will see you in the next one. Drop a comment. Let me know your thoughts on the topic. I'd love to hear it.